Did you see that a 6-year-old child died because initially 3 doses of 3 milliliters of intravenous adrenaline were prescribed? Sadly, the child died, but I believe that she died before receiving the other doses. That is, it was 3 milliliters every 30 minutes, okay? It was 3 milliliters every half hour, okay? So I think only 3 milliliters were given, and then the whole situation happened there. So, what's the point of this video? If I, as a nurse, were there, or another nurse, another doctor, maybe a nursing technician, maybe not at this level, but if someone refused, what could have been changed? So, the idea of this video is how we can reverse something that's already been done, okay? Imagine it's already been done, and we're in a situation where the child is feeling unwell, having adrenergic reactions. So how would we reverse this situation? Well, it's an attempt. It doesn't mean we're going to succeed. But as far as I've read or seen the information, nothing was done except sending a message to the boss saying, I prescribed the medication for nebulization, but it was given intravenously. Someone come here, help, I made a mistake. Guys, if you don't have the knowledge, stay at home for God's sake. How are you going to prescribe something you don't know about? And another thing, since you already messed up by prescribing it, why don't you know the action of the medications and how to counteract their effects, how to handle the situation? And I always say this and I'll repeat it. The emergency room it's not for amateurs. The emergency room is for those who know what they're doing. You have to think fast. You can't learn it on the job. Emergency work isn't something you learn day by day. You study it beforehand and put it into practice quickly. All right, guys, so let's go, okay? Don't forget to like, share, and send this video so, God forbid, you ever have to repeat this somewhere in Brazil or anywhere else in the world. There are ways you can take that might maybe save a life, you know? Based on science, on knowledge, on raw pharmacology, that's what I'm going to bring to you here, okay? So the class is going to be at that level, hardcore level, all right? Let's go. First, I'm going to give some context about physiology. Then I'm going to trigger a pathophysiology with the prescribed situation. Then I'll stop and try to do the reversals, all right? So let's go. First, here I have a massive dosage. Massive, like a horse-sized dose, right? Imagine the mass of a horse, the mass of a human being. A horse has way more muscle than any human, right? Even though I'm not a veterinarian and I don't know much about it, that's why people say horse-sized dose. It's a dose way, way above what a human can handle. So 3 milliliters equals 3 milligrams. Okay, so this alone is already extremely high, and it was supposed to be done 3 times, right? 3 times every 30 minutes. But I believe the other 2 doses weren't given. I think the mess already happened with the first one. So 3 milligrams, right? So we have to remember that this medication has affinity for beta 1, beta 2, and alpha 1 receptors. So let's put the binding priority of epinephrine in large amounts. So let's go. Who am I talking about here? The heart. Okay? Here, I'm talking about the lungs. There's more, but I'm just covering the main points, or I'll spend an hour on this. And alpha 1, let's talk more about vessels. Of course, beta 1 is found in other places, but let's focus on what matters here. With that dosage, obviously the child had an increase in heart rate. Okay? She logically had bronchodilation, which was what was intended, but it should have been done in smaller doses or through other methods, right? Bronchodilation occurred. Bronchodila. Bronchodilation. Okay, and here we had the worst of situations. Vasoconstriction. Severe. It was really sad here. This is where it happened, right? This is where, unfortunately, it happened where the big problem happened. So let's go. This increased heart rate, it wasn't any tachycardia. It was the tachycardia, man, that triggered several other problems like ventricular tachycardia, which led to ventricular fibrillation. Probably, obviously, nobody did an electro, especially because, unfortunately, the person attending, wasn't doing it. So what did we have? Problems here, problems here. This is not a problem. Obviously, we're not going to use 3 milliliters to do bronchodilation. So the prescription had a, how can I put this? A priority, a need basically to do a bronchodilation. That was the idea. But not at that dosage, not through that route, right? So these two problems here at this dosage in the small body of a 6-year-old child, that was just absurd. So let's go. Shit happened, let's imagine. The shit just happened and the child starts to fade. What does it mean to fade? She starts to have a, man, I can't even imagine what her heart rate would be. A child already has a slightly higher heart rate. 6 years old, I can't remember off the top of my head, but it's already a bit higher. Because imagine getting extremely high doses of epinephrine. The heart couldn't even take it. The amount of heartbeats that were stimulated and the vessels. Remember, with children, when they stop and return, we can't do it either. Norepinephrine because of the vessels, because norepinephrine is potent. I'm not talking about norepinephrine, I'm talking about epinephrine. We use epinephrine in children after cardiac arrest in very low doses to increase blood pressure. Not here, man. Here, a massive dose was given. Massive, 3 milliliters. It was a massive dose of adrenaline. So this here, man, you have no idea that it closed the coronary arteries. All the small blood vessels, they all closed. For sure, the kidney injury. There wasn't even time for a kidney injury because the kidney stopped immediately. In other words, we basically had a renal occlusion, so the kidney stopped working almost immediately. In other words, there was no renal flow. The flow couldn't get out either. In other words, the kidney stopped working abruptly. How do we attempt something? He had venous access. If it was done intravenously, he had access. I'm not a doctor or medically trained, have no intensive care residency or credentials, just some basic knowledge. But let's go, man. What can we do? Step by step, right? Metoprolol is a non-selective beta blocker. I mean, I can achieve an interesting blockade of receptors. Because here's the thing. If I do a beta block, look, if I do a beta, what am I going to start? To inhibit epinephrine from binding to these receptors and for this action to continue. But we have to think about the following. Metoprolol has to be intravenous, right? Not in tablet form. The intravenous mistake is done, so let's keep it intravenous. Logically, intravenous metoprolol is what we use for reversing tachycardias, and he would also have a tachycardia. Okay? So at first, just take 5 milliliters, which would be 5 ampules there. Or 1 ampule, 5 milliliters, right? Get the metoprolol to administer. So go ahead and give the metoprolol. Metoprolol, we give it slowly. Man, in this case, I'm not sure. How should we give metoprolol in this case? Remember that I'm in a catastrophic situation, right? I'm already in big trouble. For adults, we do 5 milliliters in 5 minutes. Man. If I try to be conservative, because of the tripled dose of epinephrine in the patient, I might be wasting time. Okay. It's tough, but in the emergency room, that's when you must act. Okay, I'll go. I'll think about it and put it here in a minute, but let's go then. Metoprolol. Metoprolol. 5 milligrams in 5 milliliters. Okay, it has to be done. It has to be done. There's no other way because I don't have a beta blocker. But here's the thing. What does epinephrine do? It stimulates the release of calcium. And what does released calcium do? Vasoconstriction and increases heart rate. It does everything, right? So there is an antagonist for norepinephrine called phentolamine. Man, should we try phentolamine? Let's do everything we can. Come on, let's use phentolamine. Phentolamine Let's give phentolamine through the intravenous since it will start blocking right away, okay? Alpha receptors, we're already blocking them here, right? With phentolamine, an alpha blocker. Phentolamine here. Let's give phentolamine. But here's the thing. Even if I block it, so there are no more effects, I still have to think about the effect that has already been caused. And the effect that has already been caused, how do we reverse it? Or at least try, right? Well, if the vessel is constricted, how do I do that? Another strong drug, I have both tridal and nipride, not just one. Why? Because both the coronary arteries and arteries throughout the body are experiencing vasoconstriction. Look, it's written here, severa. So in this case, if we use tridal and nipride, man, we're now forcing vasodilation on something that's already vasoconstricted. So I can reverse the occlusion and the reduced perfusion of those organs that were harmed by the excess epinephrine. To save the person, like the child. Okay, so let's put it here. Tridal, nipride. Tridal and nipride, okay? I'm not adding more information because I'll make another video researching how we could do this in... Because here's the thing, guys, this right here, look. We use it in emergency situations, but we already know how to do it safely. In other words, it's nothing off-label. We know how to do this according to protocols. Man, what we're saying here is that because first of all, this shouldn't even exist, man. This doesn't exist, okay? So reversing it is something that never, at least as far as I know, has ever been made public. Unfortunately, this has happened before, but it became public this time. So, I mean, how do we have a protocol ready for this? We don't have a protocol ready. So let's go. I'm in the emergency room and this is happening. So these drugs here would help a lot. I had thought about bicarbonate. The problem with bicarbonate is that I'm afraid to use it and lose the effect of epinephrine because it's acidic, but I could also lose the effect of other medications that have acidic pH. If I make the guy's body alkaline, it could cause problems. Bicarbonate might help, but I'm unsure when to use it. Man, it's a lot in a short time. Man, it's a lot in a short time. In other words, it's a race against the clock. Also, we don't even know if it'll work, but that's the way. Before thinking about anything else, if the child stops, you have to give these medications. Ida, but in cardiac arrest, don't you only use epinephrine? Stop being clueless. Pay attention. Forget about the cardiopulmonary resuscitation protocol and its steps. In this case, man, if I don't do this, the guy won't come back. Why? Because here, I'm in a situation where I am blocked. I don't have blood perfusion. That's why he turned pale. I blocked all the guy's arteries. It's closed. Okay? Done. It wasn't even an obstruction, right? It was a severe vasoconstriction. How am I supposed to do compressions? Why compress if he already had a cardiopulmonary arrest? If the vessels are closed, in other words, it won't do any good. What you're doing isn't working, so you need to use these medications. We need to research on how to do this and what combo could reverse these problems. There was even a nurse the other day who died, so I think it was last year. She got norepinephrine, man. She got pure norepinephrine in her vein. She died too. I made a video here too. At that time, I didn't make a video about a reversal. I did. I talked about phentolamine, okay? That I could have used phentolamine and unfortunately she died. But look, in this scenario, I think the ideal situation for us to consider with a breath like that, man, we managed to reverse the problem. I think this would be the way. Experienced people, those who already have knowledge, watching the video gives you time to research and reflect. So what's exciting for viewers? If you want to research and add highly technical or scientific suggestions here, man, I'll pin the best comment. I'm really thinking about saving it, man. So what is this for? Content, so that if something goes wrong again, right? If this happens again, we'll be able to have it there, at least for those who watch this video. Obviously, they'll already have ways to reverse a situation of this magnitude, which is catastrophic. All right? So guys, that was the content, okay? I hate this kind of content because after it happens, it seems like solutions come from everywhere. But thinking about it, man, it happened. If this happens again, God willing, it won't. I hope this video helps people in emergency rooms. That's why I always say, study before leaving home. Studying in the emergency room doesn't work. You can't just check your phone to decide what to do. You won't find this anywhere for this situation because this situation doesn't exist. So, if Ada were there, it doesn't mean I would have made a difference in the child's life, unfortunately, given what had happened. But I have the reasoning to try to do this here. Obviously, it would be very desperate. For my part, as a care nurse, it would be desperate to suggest doing this here. Why? Because it's something that's new. New in what sense? Man, it's a situation that's gotten out of control. It was out of control before, so now it's already out of control. This here actually is a gamble. It's a gamble. Now, how do you gamble with life, man? It's tough, you know what I'm saying? I hope it doesn't happen to you guys, but man, have the presence of mind to at least think about the consequences. Okay? There's no antagonist for epinephrine. There's no antagonist for epinephrine. I can block its receptor, not block the epinephrine itself. So, guys, studying is something that can't stop if you want to make a difference, to save someone's life. I hope this video gets a lot of views so that more people become aware of studying, of knowing that science is what truly saves lives. There are no shortcuts or easy ways. You just have to sit down and study. In an emergency, there's no time. There's no app, nothing that will help you reverse situations like this. You saw what the doctor did, right? Help, someone come down here. I don't know what to do. When you lack knowledge, panic sets in. Unfortunately, it was already over. Your reputation, life, conscience, and another's life.